Good afternoon, everyone, and welcome to our Delaware SHIP special topic webinar titled The Pandemic, Public Health, and a Path Ahead from COVID-19 Impact to Addressing Systemic Inequities and Improving State Health. Thank you so much for joining us today. Next slide, please. Okay, looks like our slide might be frozen. Give us just a minute. There we go. And my name is Noelle Duckworth, and I am the SHIP project manager for the Delaware State Health Improvement Planning process. And I'm going to just start with some quick housekeeping for us today. We have ASL interpreter team with us today, so we have spotlighted that video for folks to be able to see our interpreters. We also have remote English captioning occurring, and there is the link. I am also going to put that link right here in chat right now for anyone that might need that to bring that up simultaneously. And we will use the check box to share info or report a technical issue, say hello to colleagues. But our audience lines are muted, but we do hope to have an interactive webinar for you today. We will have opportunities for you to post questions to our guest speakers, our students, and our grad students that are here with us today, presenting their research and their interviews with SHIP stakeholders. And that can go in the Q&A box, which if you look in your Zoom tool at the bottom there of your screen, there's a little folder that says Q&A. Please post any questions you have for our students about their research or this fellowship program or process in that Q&A, and we will have time for posing those questions to our students later on in the webinar. We'll also be polling you, so please, we encourage you to share your thoughts. And finally, the webinar is being recorded, and it will be made available after today's live webinar on the Delaware SHIP website. Thank you. Next slide, please. Okay, and as I said, this is a special topic webinar as part of Delaware State Health Improvement Plan, what we call SHIP. Next slide, please. And Delaware SHIP is a partnership and a project led by the Division of Public Health at Delaware Health and Social Services. And we at the University of Delaware Partnership for Healthy Communities, a community engagement initiative at the university, are very pleased and excited to be a part of this project and help manage it for our Division of Public Health folks. And the purpose of a SHIP, just to help you all know if you're new to this process, is to describe how the health department and the community it serves will work together to improve the health of the population. So it's not just a strategic planning document or plan for just our health department. It's for all stakeholders in Delaware that are working towards improving the health and well-being of all Delawareans. And next slide, please. To develop the current plan, there was a state health needs assessment that was conducted across the state with stakeholders from many different areas, and that was published in 2017. And that was followed by a SHIP plan, a 5-year plan covering 2018 to 2023. And so we're about midway through that action cycle right now of implementing that state plan. The state plan identified 4 priority areas: chronic disease, maternal and child health, substance use disorder, and mental health. But the plan also strongly encouraged all stakeholders to take system-wide recommendations beyond those individual health areas and focus on a policy, system, and environmental approach, or PSE, address social determinants of health. There's been a lot of conversations happening about that, social determinants, as that science continues to unfold, and promoting a health in all policies approach, and really thinking about how policies that we have put in place, no matter where they originate or what sector, how they have an impact, potentially good, bad, or neutral, on population health. And then finally, incorporating social marketing. Next slide. So for the past year, for the 2020-2021 year, we've been very busy with our students and staff and our SHIP team at DPH working on lots of different areas of the SHIP. We released a 2020 annual report that came out in December, and then we held virtual roundtables throughout the month of January to review that report with stakeholders. We talked about the activities that had been occurring over the past year in response to COVID, but much broader with the health improvement of the entire state, as well as any gaps that existed, data and indicators that we were looking at to see what kind of progress we were making or where more progress was needed. We also have been conducting stakeholder surveys. We took some polls at those roundtables to hear from folks around, what objectives in the SHIP plan do people feel have been fully met, or are there ones that we need to revise, and are there new ones that we really need to be looking at before the end of this 5-year action cycle. Speaking of which, we have launched a SHIP stakeholder survey this morning. Many of you that are on our mailing list received that link. We encourage you to take a few minutes to fill it out. We'll also provide it to those of you on this call, and you'll get an email following the webinar with that link. So we encourage you to take some time and give us your feedback, whether you're a Delaware resident, whether you lead a grassroots or state-led agency or task force, whether you work in public health or other sectors that have health impact, whether it's some of the things we're going to talk about today, housing, the workplace policies, prisons and criminal justice reform impact on health. All those things are really important to bring to the table because our 2020 annual report really had a broad frame on health. And we really looked at engaging SHIP stakeholders well beyond the traditional public health or medical field. We've been working with our students that are part of the UD Partnership for Healthy Communities to develop some special topics to really help give stakeholders good information around science-based literature and as well as policy and system and environmental recommendations and the impact of COVID on these different topics, and to provide stakeholders with information so that they can use that in their advocacy, in their own planning, or their delivery of services. And in January, we had an intensive fellowship program for 1 month over a winter session where students produced a series of, an at-a-glance series of 14 different briefs on gender-based violence and public health. And that was part of the Division of Public Health's Rape Prevention Education Program. So those are on the Delaware website now. And then today, we're very excited to bring to you another at-a-glance series that our students have been hard working on this whole spring semester. And we're coming down the home stretch this week, last week of classes. And they have been working on topics that were brought forth either as part of the virtual roundtables that we held in January with stakeholders and or through the Division of Public Health as key issues that they wanted stakeholders to receive more information on so that they could make informed decisions in their planning and advocacy. And those 3 topics are prisons and people who are justice involved, housing and homelessness, and the labor market and essential workers, in particular, looking at women and their representation in the labor market. Finally, we would be conducting SHIP communications through a new website, through an email, and then routine email updates that would hopefully help bring all of you here today since you're registered for the webinar. Okay, next slide, please. So without further ado, I would like to turn it over to our director at the Partnership for Healthy Communities and the principal investigator on our SHIP project, and that's my supervisor and leader, Rita Landgraf, who many of you know as the former secretary for Delaware Health and Social Services for 8 years under Governor Markell's administration, someone who knows an awful lot about the approach to health and well-being in Delaware, has dedicated her career to this topic, and we couldn't be happier to have her leading us in these efforts. Rita, can you take us from here, please?
Thank you so much, Noelle, and thank you also for your tremendous work in managing Delaware SHIP. It's a real honor to have that work appear under the UD Partnership for Healthy Communities. And you not only serve in the role with Delaware SHIP, but also in the role with being our coordinator for the partnership. And I just want to share a little bit as to why this is such critical work under the Partnership for Healthy Communities. As you see here, our mission is actually to align and strengthen the University of Delaware's research, our educational outreach, and our service capabilities to really focus in on, from a public health lens, improving the health and the well-being of Delaware communities with a primary focus on those communities that have been made vulnerable due to structural racism. So largely, as when I served as secretary, I know those communities throughout our state. The data has shown these are the communities that have been oppressed and segregated, and we can see the poor health outcomes largely due to the result of these inequities. So coming to the University of Delaware, our partnership is actually going into its 5th year of existence, and we are part of a bigger framing here at the university called the Community Engagement Initiative, which falls under our provost. It's cross-college, and the one thing that we at the partnership really love about this work is not only the work itself, but actually the work that we are able to engage with our students, both our graduate students and our undergraduate students. Next slide, please. So we like to show this, I call it the circle, and really what calls for a healthy community, and it really goes beyond just healthcare. Although many think of health from a healthcare lens, it's much broader than that. And as you heard Noelle talk about the social determinants of health, where you work, where you are born, where you live, where you age, where you go to school, where you spend most of your time really does make a difference in your overall health and well-being. And what we really want to be able to do with the partnership is not only, again, bring that research and our student engagement to really support communities, meet communities where they are, along with co-directing this work with the community itself. How do we embed equity throughout all of this work? And how do we really frame these issues? And I'm really excited that you're with us today, because you will hear right from the students themselves what they've been able to do relative to their literature review, relative to their interviews with stakeholders, to bring this work forward with you. And without further ado, Haja is our graduate student, and we've been very fortunate to have Haja working with us this semester. She has just brought such tremendous insight to this work, and her engagement with the students as well is really bringing a highlight to the work that both Noelle and I get to do every day. So we're very, very grateful to have Haja as part of our team. So Haja, I'll turn it over to you.
Thank you, Ms. Rita. My name is a little bit about me. My name is Haja Turay, and I'm a graduate student at the University of Delaware, majoring in epidemiology. I also have a really extensive record with the University of Delaware, because I also got my Bachelor of Science from the University of Delaware in Health Behavioral Science with a minor in public. Currently, like Rita stated, I'm also a graduate fellowship student with the Partnership for Healthy Community. With the Partnership for Healthy Community, and I, like in that role, I serve as the SHIP Undergrad Fellowship Program Supervisor. Before we go into before we start the presentation, this wonderful presentation, I would like to take a brief poll. Okay, so the poll question for today, audience, is: in the past, how often have you framed issues of criminal justice, housing, and the labor market as matter of public health? and the choices are to a great extent, somewhat, very little, not at all. Okay, we're almost there. We really appreciate everyone answering these polls because it will really inform a lot of processes. We're almost there, 22 out of 30. Okay, so I'll end the poll right now. Next slide, please. So a little bit about our fellowship programs. The fellowship program was developed last winter. With this program, it is the goal of the partnership to contribute to the personal, educational, and career development of the University of Delaware student. And with those, I like the fellowship program is very engaging. It kind of like really is extensive because they kind of train undergrad student in many different skills as it relates to public health. And it also gives them opportunities to engage with different stakeholders and participate in different state events. The fellowship with the launching of the fellowship program, next slide, please, sorry, next slide. These are the processes of the fellowship program. The first process of the fellowship program was the content creation. In preparation for the launching of the fellowship program, I worked with Noel to create content and develop lesson plan for the fellowship program. In light of that, I created and organized a series of Google documents that are made available to our students. The Google documents included sections such as the weekly schedule, which kind of just help keep everything organized, and like it kind of had specific objective and goal associated with them so that we're able to like do the work in a timely manner. We also had assignment guidelines for our students to utilize in doing different assignments as it relates to the SHIP fellowship process. We also have weekly discussion resources that help our students discuss the fellowship material and also engage with their teammate about the fellowship experience and to facilitate learning. The fellowship program also had orientation session. The orientation section lasted for a week where we got our student introduced to a different topic in public health, public policies, and to just like make them aware of some of the issues that it would be, being exposed to and some of the issues that Delaware is facing as a state. We also, as part of like the training processes, we also had the weekly Zoom meetings where we got to meet once a week and discuss different issues and give our student opportunities to ask questions and become more engaged with the process. As part of the fellowship program, I also developed materials on framing, public health, public policy, health inequality, health equity research, and etc. Therefore, throughout the practical experience, our students engage in various training exercises on topic in populational health, public health, framing, research, and etc. For example, our students learn how to frame different issues as a matter of public health, which will be demonstrated in their eyeglasses. Our students also learn how to develop key informative interview guides, conduct key informative interviews, and also engage in a lot of different research processes such as developing annotated bibliographic. Our student also, can you go back, please? Our student also got to utilize the SHIP team assessment tools at various different meetings throughout the state. They utilize the state team assessment tool to various stakeholder meetings to capture the work that our partners are doing, which help inform this Delaware State Health Improvement Plan write-up and just bring different stakeholder perspective and voices to the Delaware State Health Improvement Plan. Throughout the process, we created different opportunities for our students to engage with stakeholders by attending meetings and also by just collaborating with stakeholders to collect important information for their practicum deliverable. A series of at-a-glance documents showcasing different issues as a matter of public health. The at-a-glance document also share evidence on strategies and policies.
Okay. I found this on the web for a set of different issues as a matter of public health.
for policies, and I also share like different evidence on policy and strategy for different sector and for Delaware stakeholders to consider in our collective aims to improve the health of all Delawareans. As it relates to our application process, ultimately the goal of the fellowship process was to collaborate with as many students as we can across different disciplines at the University of Delaware. And the partnership is all about ensuring equity. So therefore, in order to ensure equities in our application process, we created a scoring system that assesses student application based on their fellowship requirement and different credentials as it relates to working with the partnership. Example of one of the requirements our student needed to have was that they needed to like have completed intro to public health, which kind of helped them like become aware of like different issues in public health so that they can come to this competitive and accelerated process and just learn so much and produce the Alleghance documents and participate in different webinars and in a more adequate way. We also ensure, like throughout this process, we scored the application from on a scale of 1 to 5 to ensure that the student was selected with the higher one. We ensure that our interviewing processes were equitable by developing pre-interview questionnaire. All the students were asked the same questions. We assess the student based on their level of knowledge in answering those questions. We also assess the student based on their interest and passion for improving population health and just for like being a part of SHIFT. Next slide, please. As the result of the practical experience was a series of 3 different Alleghance documents. This particular series is called The Pandemic, Public Health, and a Path Ahead, from COVID-19 impact to addressing systematic inequality and improving state health. And the topic of the Alleghance is on criminal justice reform and health. The criminal justice reform and health Alleghance is called The Pandemic, Prison, and Public Health by Danielle White. And then we also have the labor market, injustice, and inequality and health. That Alleghance is called Women's Public Health and the Workforce. The Health Connection by Alexis Turner. And then lastly, we have the Housing and Health, More Than Just a Roof Over Our Head. The Home is Health by Connor Griffin. And without further ado, next slide, please. Without further ado, I would like to introduce our students. We have Danielle White presenting today. We also have Alexis Turner and Connor Griffin.
Hello, my name is Danielle White. I'm a sophomore at the University of Delaware. My major is health behavior science, and I have a double minor in psychology and public health. And in the future, I hope to get my master's in public health.
Hello, everyone. My name is Alexis Turner. I am a junior here at the University of Delaware studying health behavior science with a minor in public health. And my future goal is to eventually become a doctor.
Hi, everyone. My name is Connor Griffin. I'm a senior at the University of Delaware, majoring in public policy with a minor in public health. This fall, I'll begin enrollment in a Master of Public Health program specializing in health systems and policy at Rutgers University, New Brunswick.
Thank you, Danielle, Alexis, and Connor. Next slide, please. We're not going into a facilitated discussion section with our student and Ms. Rita, the director of the University of Delaware Partnership for Healthy Community.
Thank you, Haja, and thank you, students, for being with us today and sharing your wonderful engagement as well as your research. So for the next about 40 minutes, I am going to be asking each of you the same questions and ask you to kind of reflect on that based on what you have learned as you were creating your at a glance information, and looking forward to kind of hearing your spin on this. Each of you have a topic that in of itself demonstrated the inequities and the vulnerability of these populations. Now, COVID actually put a spotlight on that, if you will. So Danielle, I think I'm going to start with you. And here's the question. Again, then that question will be for both Alexis and Connor. But here's the question, Danielle. How COVID has shed the light on these issues. Explain what you have learned relative to COVID and the area that you were focused on, which I believe was really the criminal justice and prisons. So what did you learn, especially when COVID hit relative to that population?
Yeah, so my topic was criminal justice reform, and it's like relation to health. And I noticed, well, I saw that there was a great cluster of COVID-19 cases in these prison and detention centers. And this shed a light on the poor conditions of these facilities before the pandemic, because many of these facilities had poor sanitation, they were overcrowded, and didn't have the right resources to allow these people to live a healthy life, even if it was in jail. So those who are confined are often at greater risk for infectious and chronic diseases, both while imprisoned and even after they were released.
And your research just further generated that amount of information relative to COVID specifically and impact?
Yes.
So Alexis, now I'm going to shift to you. You did some really also impressive work, same as Danielle, but your topic was really focused on the impact of COVID on women, and especially women in the workforce. So share a little bit about what COVID spotlighted for our women, and especially, I believe, essential workers.
Yes, I just want to make sure. Does my volume sound better now? Is it okay?
Yes, yes,
okay.
Thank you.
So I kind of just wanted to start off with answering that question with just stating the fact of why so much our focus was on women in the state of Delaware. Essentially, it's because in Delaware, 77% of Black mothers, 53% of white mothers, 44% of Latina mothers, and 37% of Asian mothers are breadwinners within the state of Delaware. So essentially meaning that women's wages do support households. So just kind of drawing on the importance of that and how important, how intricate women play within the state and helping to provide for families and to keep, maintaining health for not only themselves, but for their families and children as well. So kind of with the pandemic, it kind of shed a light on the fact that women were placed in such an intricate situation in terms of either being at risk of losing their jobs, because a lot of them do make up the service job industry, such as like waitressing or anything in that nature, more person-to-person contact. And then they were also faced with the impact of being a large portion of those that work essential frontline jobs, such as grocery workers, healthcare workers, and just any of those nature that have been, really required during this time. So it's been important to maintain the health of our communities. So a lot of women have had to be put in a situation where they've been, faced with these obstacles and faced with the obstacles of, maybe not having enough hours at their job because hours have been cut back due to schools and childcare centers closing down. A lot of children have been, placed out of those programs because it's been known to spread a lot of person-to-person contact and put people at more risk of COVID-19. So, historically, women have had to actually depend on childcare centers and schools in order to be able to go work, because a lot of these, like I said earlier, a lot of these women are breadwinners, and a lot of these jobs do require them to leave, when necessary in order to provide for their families, or they're faced with the decision to either stay home and take care of their kids and lose hours at work, and that therefore means that they lose money and then they can't feed their children. And it's just a really, really big issue that I feel like COVID has helped to exasperate in terms of the fact that this position shouldn't be held by women within the state of Delaware, but unfortunately it has been the ultimate deadline. So.
Thank you, Alexis. And I know you're, specifically concentrating on the women in the state of Delaware, but I also believe that this was happening on the national front as well, and impacting women in a disproportionate way, especially women that had children, that had families. So thank you. Connor, we're gonna move over to you and the great work that you did relative to housing and the impact that COVID had on housing. And what did you learn from your lit reviews?
Sure. So COVID-19's effects on housing were some of the clearest and most profound among the many areas of our society impacted by the coronavirus. So the issue of housing has been a major point of discussion, obviously, since the pandemic began. When it becomes necessary to social distance and quarantine in order to curb further transmission of the virus, having more people in stable and affordable homes is then critical for the overall public health effort. For example, one study actually showed that higher rates of incidence and mortality for people in housing that was overcrowded, of high cost burden, or had incomplete kitchen or plumbing facilities. Also, the eviction moratorium was also necessary for keeping people safe in their homes and off the streets. And you actually saw states that lifted their eviction moratoria sooner had higher rates of COVID-19 incidents and mortality. So overall, with the COVID-19 pandemic, it's demonstrated above all else a necessity for a stable home.
Thank you. Thank you. So my second question then, and Danielle, we're back to you and your prison criminal justice lens. How have these issues been framed historically? And why might a public health framing assist us in actually moving forward?
So historically, mass incarceration specifically has been viewed solely as a criminal justice issue, which would make sense. But you also have to look at it from a public health issue because it fuels chronic disease and mental illness. And that's something that is important to our communities and individuals as a whole. And even looking from a broader perspective, it harms these individuals' families and also the communities surrounding them. So it's important to realize that it doesn't only affect the individual, but it's also affecting the population, especially considering COVID-19 with mass incarceration. People are going in and out of these facilities, not only those who are incarcerated, but also the staff members. And when they're coming out, it's exposing us too. So it's also something that's affecting everybody's health. And some research that stood out to me was that almost 10 million children have experienced a parent incarcerated at some point in their lives. And this just raises their risk of either substance abuse or even having criminal records themselves. And it just keeps the cycle going and affects their health overall. And so they can't live a healthier lifestyle moving on, which is why it's something that we need to look at as a public health issue.
And you just touched upon something, Danielle, that it not only it impacts the individual, but it impacts the entire family. And you brought up those adverse childhood experiences, and an ACE score when one family member is incarcerated, the impact of that from an adverse childhood experience and the trauma. And so even, historically, I'm sure that has impacted maybe multiple generations, and how society deals with that has also been from a disproportionate lens as opposed to the public health lens.
Yes.
So thank you for bringing up those, the ACEs. And so Alexis, how about from your study of women in the workforce, again, historically, what was brought to light for you?
So I guess kind of when you think of the economy or job loss in general, you think of it as an economic issue and not a health issue. But income is a key factor that influences the health outcomes of families, individuals, communities, and also finances are strongly linked to a person's ability to access healthy foods and other resources. And so that can create a link between poverty and chronic diseases such as diabetes and obesity. So in other words, this is a health issue. It is not just an economic issue. You know, a lot of women have been faced with losing their jobs. You know, like I said, it's very intricate, and there's like different ways in which women have been impacted. But during this time when they've either, you know, lost their job or had reduced hours at work as they've had to take care of their kids, they've had to allocate limited funds towards cheaper, unhealthier foods and other items, you know, to help their family survive. So this is not only impacting like nutritional statuses, but it's also creating unnecessary stress. You know, if you're faced with the decision of, am I going to be able to provide for my family, or should I go to work and, you know, put myself at risk of contracting COVID, as these are essential frontline worker jobs? Which way do I go? And ultimately, that's going to create mental stress, and those stressors will develop over time and create way more health complications than necessary, than we need, than, you know, should even be a problem. So this one survey that I found that I felt like kind of spoke volumes to this impact. It was conducted by a foundation, and so that they found that over half of the mothers in the study with school-age children said that stress and worry the pandemic has affected their mental health, and 1 in 5 of those mothers characterized their stress as major. So it's all these problems coupled, and so it's not just economic, it's way more than that. It's health.
Thank you. That's solid framing, Alexis, and you're right. We tend to think of it more just from an economic standpoint and don't really appreciate the relationship of health, and how that, you know, living in poverty is very bad for your health. And in fact, it steals life expectancy from you. And I think you just kind of highlighted how it touches upon a variety where you live, how it touches upon access to healthy foods, how stress then impacts your overall health and well-being. And I'm sure your research has shown that COVID has extended that as well, and the stressors of this pandemic. And who are the individuals, again, who are disproportionately impacted? And your research is showing, you know, women had a high vulnerability. So Connor, to you too, how have these issues been framed historically? And what is the benefit of viewing this from the public health lens moving us forward?
So housing historically has always been incredibly important, but public health framing can assist us going forward because there's a widespread lack of affordable housing, especially that which is accessible for lower income households, many of whom are minorities who have been historically discriminated against by inequitable housing policies and zoning laws. To illustrate this lack of affordable housing, in 2015, almost 40 million American households spent over 30% of their income on housing, and almost 20 million households spent more than 50% of their income on housing. So it's a significant issue. And then given this scenario, many American households then face a dilemma of being able to pay their rent or mortgage versus being able to put food on the table, being able to send their kids to college, affording healthcare, and lots of other necessities that support their overall health and well-being. Also, there are numerous physical and mental harms associated with housing instability that include elevated rates of psychological distress, anxiety, depression, chronic disease, mortality, and suicide.
And I don't think like we recognize the magnitude, right, of everything that you are saying. Like we kind of look at it from a tunnel vision almost, right, and how it extends actually beyond and the disproportionality of every area that the three of you had touched upon. I want you to do a deeper dive for us about, even if you touched upon what is happening nationally, and what research actually stood out for you in terms, and some of you have already touched upon it, but go even a little bit deeper for me about what in that research stood out for each of you in terms of the broader health implications in these areas. And even like, I love that each of you is also thinking about this not only from a physical health perspective, but also tying in that behavioral health. You know, many times we didn't see that as part of this impact. So Danielle, from your perspective and from looking at that research, what are the broader health implications that you can bring forward that really stood out for you when we think about incarceration? And, you know, even when we think about the inequity of the criminal justice system.
Yeah, so some like health inequities that stood out to me was that how mass incarceration disproportionately impacts lower income communities and also communities of colors and people with disabilities, creating barriers for them to even achieve health equity in general. People of color represent 39% of the national population, but make up 60% of incarcerated persons. And that right there speaks volumes as to like the history of the system and why it needs to be changed or reformed. And these same groups of people are at greater risk for contracting COVID-19. So when you put them in that position, it only is just building their risk up even more. And I also saw a lot of research of how many people stay incarcerated because they cannot pay the funds for bail. And that just goes to show, like Alexis and Connor talked about, how lower income families and things, like it's just built up against them. So even when you are put in that position, it's harder to get out.
And I think, Danielle, you just highlighted something by bringing in your colleagues, right? So when you think just in general of the overall vulnerability of and the inequities, right? And then you think of someone who has engaged in the criminal justice system, right? And then the challenges relative to if they're a woman, right, coming out of the criminal justice system, the challenges even from an employment perspective and being able to have a livable income. If they have been incarcerated, you know, there's stigma attached to that. So they're further made vulnerable. And then Connor, you know, the availability of quality, safe, affordable housing in general has been an issue for our state and the nation. But when you add on these other vulnerabilities and, you know, incarceration, depending on the crime, many times you're prohibited, right, to live in certain areas because of that, you know, stigma and because of the crime that might have been committed. And again, Danielle, give me that statistic that you said about earlier. I just want that to sit with people for a bit about the incarceration rate.
Yeah, so 39% of the national population is represented by people of color, but 60% of incarcerated persons are people of color. So like you were saying, like it just goes to show the history that mass incarceration has on minority people, and also like just how you were saying, like once you get out of one loop, it's just like you still have other disparities and issues that you have to address, which makes it hard for these people to get out of the system in general.
And then the behavioral health, the stress component, right?
Mm-hmm.
What you just said. So Alexis, how about if you pick up from there and, you know, give us a deeper dive about what was the research that stood out, you know, for you, even if you touched upon anything from a national perspective. I think I looked at statistics that were in your at a glance, and I was really stunned by even the difference in race, like even if you're sticking with gender, women, and the difference in your earning power, depending on what race you're in. We already knew there was a gender bias overall, but then when you did a deeper dive, do you want to share a little bit about that?
Yes, I think that's a perfect segue into what I kind of wanted to touch on. I did definitely pull that statistic out because I think it is so important to look at and important for everyone, to take into account when they think about the problems that women within the state of Delaware face, as well as women of color that are also disproportionately impacted. So the statistic was that there is a wage gap that does exist. It's between white men and women of color. So for every $1 a white man makes, Delaware Hispanic women make 59 cents, Black women make 68 cents, and white women make 84 cents. So these jobs and the wage gap contributes to the existing gender and racial gaps that persist in society and have negative implications on the health of women, especially among Black and Latinx families. That alone speaks volumes into the impact, like Danielle was saying earlier, that if people are able to get out of, prison and they find a job that maybe, allows them to be able to, work, a lot of these jobs are low wages and they're already facing a gap between the wages in which they can provide for their family. And also another thing that I wanted to point out was that there is a lot of overrepresentation of women of color in these low paying jobs, and they are putting themselves at contracting COVID-19 because a lot of these essential jobs are person to person. And so even with the mandates of the mask and proper 6 feet social distancing, it doesn't necessarily guarantee an individual that they will not contract COVID. So again, when you're faced with the option of going to work or staying home to take care of your children, or wanting to work because you want to provide, you're faced with those obstacles, and it's not really fair. It's not equitable. And so just kind of like to, I guess, leave on a note of this is that, the workforce challenges brought on by the pandemic and the underlying systemic conditions, further amplified by COVID-19, are not just moral and economic issues, but important matters of public health and equity. Women's participation in the workforce is a health issue. Gender equity is a health issue. The gender and racial wage gap is a health issue. And so I just feel like we need to pay attention to this and keep this into account when we look at fixing these issues and making sure that we ensure the health of all Delawarean citizens.
Alexis, and along with that, and I have your at a glance in front of me, I was looking for it, not only the statistics that you highlighted relative to women compared, the gender bias in their earning, $1 perspective, and the difference even in race relative to that. But also, I thought I saw too that you highlighted women as breadwinners. And the difference also, can you talk a little bit about that?
Yes, so I think I did speak about this statistic earlier with in Delaware, 77% of Black mothers and 53% of white mothers, 44% of Latina mothers, and 30% of Asian mothers are breadwinners. So that alone kind of speaks volumes to the fact that women are providing for their families. And when faced with not only implications of the pandemic, but implications of the workforce in which they're forced to work in, they're not given the tools and resources necessary in order to provide adequately for their family or to even, maintain their own health, let alone the health of the community and everyone that's impacted as well.
And that's why we also see the extreme poverty, multi-generational poverty that we see due to those inequities. Okay, Connor, I haven't forgotten you. So, what health inequities, and also from a national perspective, and really, you did touch upon this a little bit, but what highlighted in your mind that research that covered, the gamut, even beyond housing, but the impact of these inequities and how homes can contribute.
Of course. So the issue of a lack of affordable housing has certainly been a problem here in Delaware, but it's also been a nationwide problem for some time now. As I touched upon before, access to a stable, affordable residence is something that serves as the foundation for securing the other necessities like food security, quality education, a well-paying job, or healthcare services. In terms of touching upon the inequities related to not being able to access affordable housing, you've seen it played out in the most extreme with lower income households who are predominantly also households of color and have been historically discriminated against unfairly and unjustly. One of the biggest examples is unfortunately with the African American communities who were denied equitable access to housing for so long, which you saw with traditional practices like redlining that segregated their communities. This is something that has caused them to face much greater challenges in terms of being able to access a good education, high opportunity jobs, essential healthcare, and other basic needs on the same level as other populations. Also, when these groups aren't able to access these resources equitably, they're going to face additional risks, including substance abuse, homelessness, unemployment, food insecurity, and violence. And as we mentioned before with Danielle and formerly incarcerated individuals, the mountain is just that much higher for these individuals as they come out of prison and try to balance their lives.
Thank you. So again, even though each of you took a specific topic, you see the integration, the relationship across each of your work, but also universally across. And again, you know, there's impact Delaware specific, and many of you actually focused on Delaware specific, but Delaware is not the only state that faces this. I mean, I think we as the United States are facing these high levels of inequity. And then I know you explored policy, right? So it's not all about defining the problem, but then how do we advance the recommendations and how do we advance equity? And I do want you to spend some time sharing what some of your findings are relative to that. And Danielle, I wanted to circle back to you because I believe you do have more of a Delaware-centric information relative to our incarceration rates and the health impact beyond incarceration and as people are moving forward with reentry. So how do we break that cycle? And we've heard actually from your colleagues some of the challenges relative to breaking that cycle. So what can you share in that area, Danielle, about the Delaware incarceration rates and anything you would want to add about working reentry?
Yeah, so I found surprising statistics that I personally didn't know, that Delaware had the 10th most prisoners per capita, and many people know, well, a lot of people know that the United States incarcerates more people than any other nation, but to see that Delaware ranked 10th in this was really surprising. And once released, formerly incarcerated people face higher mortality rates and limited opportunities for things like employment, stable housing, education, and other essentials. So it's vital that we start making reforms. So like we talked about previously, people can at least move on and at least try and pursue a healthier lifestyle once they're released.
Wow, that is kind of stunning, right? And as you said, you were even surprised by that. I know I am as well, and probably many others. And there lies the need to do the work that you did. And how do we bring that forward? And I'm going to come back to you, Danielle, but I'm going to go to Alexis next and Connor, and then come back to you with a new question, but kind of segueing into these recommendations and how do we approach this moving forward with a public health lens, but with doable policy changes, doable system-wide approaches. So what system-wide approaches based on SHIP recommendations, because people have been in this space, stakeholders. I know you were involved with maybe several stakeholders that bring a level of expertise and shared with you. So what are the system-wide approaches based on recommendations did you identify for these issues? And you might even weave in policy and system approaches. What does the science recommend? So Alexis, I'm going to pick up with you, but Danielle, remember my question. Go ahead, Alexis.
So just to, begin with answering that question, I just wanted to state how the pandemic has shown the importance that women and mothers play within our society and how they have not received the resources and tools necessary to support their critical role in the workforce, such as equal pay, paid family leave, and universal childcare. So this underscores the importance of putting forth equitable, health promoting policies that can support women in the short and long term. So to further answer your question, applying a health in all policies approach for the state of Delaware is applying it is important. But I want to start off with defining what it is first. So a health in all policies approach is a decision-making tool that would help policymakers from multiple sectors in Delaware and beyond continue to explore and identify policy levers that can not only aim to restore our economy, but improve our health and achieve equity. So some of the policy recommendations that I did stumble across during my literature reviews was increasing the minimum wage, as it would help to improve health outcomes, as it would increase financial access to resources necessary to fulfill health in all areas, such as safe and affordable housing, healthy foods, and safe neighborhood conditions. Another policy that would help improve the health of women is the use of COVID-19 relief funding for child care service centers to stay open and to have the resources necessary to promote safe reopenings and safe, continuing to make sure that none of the children there do contract COVID or that their families don't as well. And then in addition, another policy decision should be focused on implementing paid family and medical leave, as well as paid sick days to improve women's health and public health. Sorry.
And Alexis, along those lines, because some of those things you highlighted are the very things that are being debated right now down in Delaware State House. But have you found that some of those things there could be controversy or conflict around those recommendations? And did you want to touch upon that at all?
Yes, of course. I think with anything that people might see as, I don't want to say radical, but some people might view it as that and might see it as a problem that should be placed upon the individual and not the community as a whole. And, with a public health lens and even as a moral, conscience, it's not the individual's fault. A lot of these circumstances they're put in can be averted with the use of, certain policies put in place. Like I said, for example, paid family and medical leave, when women are faced with the decision to either stay home and take care of their kids or, figure out something else, why should they be burdened with that stress when it doesn't have to be a problem? And then not only that, with childcare centers, receiving funding, like I said, historically, women have had to rely so much on childcare centers. Why would we not give them the tools and resources in order to, not have to have that worry that could be totally averted, like I said. So I think, yes, many of these policies are very controversial, but I do think if we were to proceed with them and make sure that they are, covered and that we put forth, that a lot of the women in the state of Delaware and their health would be improved.
Yes, thank you, Alexis. And one of our most famous prominent blue hens, President Biden, is surely coming out with some strong policy to address those very issues that you just highlighted. With his ability at the United States level, especially focused on children and families of young children, and providing a level of subsidy to better support the families. So nationally, we're seeing some of these policies take hold. Locally, we're having some pretty meaningful discussions down in our state house. And I think you're spot on when you talk about it from a public health lens, because for far too long, we talk about it at an individual lens and a blaming of a population without looking at how did we get here? What is the root cause? And the structure that has been created, and how our policy can actually heal that, or our policy can perpetrate it. And, I think everybody here is hopeful it's going to heal rather than continue to perpetrate or perpetuate those inequities. Connor, I'm coming to you with that housing framework and what you've heard your colleagues weigh in on. What are those systemic recommendations that you would like to bring forward in housing? You touched upon some of them that COVID has highlighted. Eviction moratorium is one. Some of that's being challenged when the CDC extended it, and they're saying the CDC didn't really have the authority to do that. Again, so sometimes the conflict that occurs, even in healthy recommendations. How can you weigh in on this from what can we do system-wide to bring forth possibilities relative to quality homes and people having access?
Of course. So similar to Alexis, I actually kept in mind a health and all policies framework, which she now conveniently provided a nice definition for all of us. Because most importantly, affordable housing it's something that necessitates cross-sector teamwork between obviously a lot of different stakeholders and entities. That includes the federal government, state and local governments, nonprofits, community organizations, and the healthcare system. So, one of the recommendations I provide is expanding coverage of low-income housing assistance programs, such as one example is the low-income housing tax credit program, through subsidizing more housing, which would greatly assist individuals who are cost burdened by their rental payments and therefore going to be at risk for poor health outcomes. Secondly, I also found evidence that hospitals, which already are large stakeholders in our communities that contribute community health programs and infrastructure towards improving patient health, they can continue to invest resources into affordable housing and other services, especially because hospitals are one of the stakeholders that they experience the most high cost burden of seeing these homelessness and other individuals who are suffering the effects of housing instability. They're experiencing all of these avoidable health problems, and they're the ones that have to treat these individuals when it could have been prevented in the first place. Also, a third strategy I'll offer is bypassing strict zoning regulations in order to build more affordable homes in what are considered to be high opportunity areas, because the availability of affordable housing in a stable built environment for individuals and families enables them to be able to access high quality employment and good education, while also being able to benefit just from safe and healthy neighborhoods.
Thank you, Connor. So Danielle, I promised you I'd come back on this one to you. So any system-wide policy recommendations that you would like to highlight relative to, the incarceration rate, reentry, anything you would like to bring forward?
Yeah, so I looked at it from a policy system and environmental approach, which is a way of modifying the environment to make the right to health a reality for all community members. And in my at a glance, I kind of just broke it down for each one, so I could just do that too. For policy, I talked about House Bill 37, which is the Public Health Emergency Credit Bill. And this basically is an emergency credit that would permit early release for those eligible. And then for a system level approach, I talked about alternatives to prison, because research has shown that mental health and drug treatment, restorative justice, affordable housing, like we've all talked previously about, have all been ways to lead people to better outcomes instead of just prison. And then from environmental approach, I looked at the crime prevention through environmental design, which would just be changing our built environments in a way that would benefit everybody.
Thank you, Danielle. And how about, so I'm going to give each of you an opportunity to weigh in. I believe you interviewed stakeholders on these topics. Danielle, do you want to talk about the stakeholders that you had the honor of interviewing and what they brought to you in order to complete your at-a-glance work?
Yes, of course. So I was lucky enough to interview the Delaware Center for Justice. I talked to their executive director, David Beaver, and their policy coordinator, Caitlin Richards. And their mission is to listen, amplify, and act to seek justice for all Delawareans. And some they talked about a lot that were really stood out to me and made me frame this in a much better way. But I think what really was a key component was their emphasis on the things that people have to face even after they're released, like how we talked about before. They talked about how it's important to have resources afterwards to help these people get to where they need to be, even when it's just basic essentials like toiletries that we all need, like things to just make you comfortable, or bus passes to get to interviews and things like that, because it's really stacked against them if they don't have these resources. And they talked on how COVID limited a lot of these resources because they're already limited before. But once all these service jobs got shut down, like Alexis mentioned, how it was impacting these women, it also was impacting formerly incarcerated people because they didn't have anywhere to really work already. And then when they are lucky enough to find jobs, they're putting themselves at risk of contracting COVID.
Thank you, Danielle. Alexis, how about you? The stakeholders you had the honor of interviewing, and how did that inform your work?
So yes, I was fortunate enough to interview two wonderful women. The first one being Miss Melanie Ross Levin. She's the director of the Office of Women's Advancement and Advocacy. And essentially it is a Delaware office that reviews and reports on the status of women in the state, as well as provides information on the status of women to agencies and other organizations. Just a little background about that. And so kind of something that she stated that I took away was that her opinions on the policies that should be put in place to help women and children in Delaware from recovering of the pandemic. She expressed that there needs to be paid and improved childcare centers provided for women, an increase in the minimum wage as many women make up low wage jobs, and more access to paid sick leave and family medical leave to help fix our economy. So kind of, just reiterating most of the things I've been saying today, but I felt like when she stated that, it really stuck with me. And then the other individual that I was able to interview is Ms. Liz Richards from the Delaware Cares Coalition for Paid Leave. And essentially, I think the title in itself kind of speaks for what they advocate for, obviously paid leave. But so essentially, it's a coalition that is comprised of many organizations and businesses. And she's been able to spearhead this coalition. And I think just recently, as of this year, it's been really gaining a lot of momentum and gaining a lot of support from many organizations and businesses. But essentially, Ms. Richards is really advocating for a statewide paid family and medical leave insurance program. And I think that it is so important that we do that. As I said, my research has stated that it's important in having these two women that are stakeholders, advocate for such policies. And if you take a look at my at a glance, there's a statement that she said that I think, really, really highlights what we need to do in order to improve the health of women in the state of Delaware and children as well.
Thank you, Alexis. And Connor, who did you have the honor to interview as your stakeholder, and how did that inform your work?
I had the great pleasure of being able to interview with Karen Speakman, Executive Director of the National Council on Agricultural Life and Labor in Dover. And I also was able to interview with Dr. Stephen Metro, Director of the University of Delaware Center for Community Research and Service. And both interviews had a great amount of knowledge for me. And among the key takeaways I pulled from both of them were just needing a greater funding to construct more affordable housing, as well as subsidizing the programs which offer financial relief and flexibility for these severely cost-burdened households. Also, part of it is social. There are also needs a shift in public perception towards realizing that affordable housing is actually beneficial for our communities, and ending this stigmatization against affordable housing because people are worried that it's going to lower their property value or it's going to detract from the overall quality of their neighborhood, which just isn't true. Lastly, a lack of affordable housing, it strains and burdens the healthcare system, as I previously mentioned, because society is paying for the reality of homelessness and people being economically burdened because so much of their income is going towards just being able to keep a roof over their heads. So it would be more conducive to all of society if people have access to affordable housing, as it prevents all these health and social issues we have to deal with down the road.
Thank you, Connor. And you just summed up the whole public health lens, because that is what all three of you are articulating is, to be a flourishing society, to be able to have that public health lens and approach the issues impacting inequities from that perspective. So very well done. I do want to pause. And if you have questions from the audience, I kind of have taken over this webinar and have had the honor of engaging these fabulous students in better understanding the research that they're bringing forward. But audience, if you have any questions, please populate it in the Q&A. I know Noelle will keep me on my toes to make sure that I see that, and I offer to our students any questions you may have. And while you do that, I am going to go back around with these three wonderful students and just ask you to reflect on the following. And I love this reflection. What is your hope for Delaware SHIP stakeholders in using this at a glance series? You did all this work, right? I think it really highlighted things for you as individuals and as scholars, but what is your hope? How will this work be used? What is your hope? Danielle, you want to start us off?
Yes. I mainly just hope that they see that all their hard work is just paying off, basically, because all this information that we're attaining, it also comes from everything that they're doing, and putting everything together and seeing how, like, from just a simple view, you wouldn't think any of these things have anything to do with each other, but they all really come together in making public health and improving Delaware's public health specifically. So basically, I just hope that they see that how much their work is paying off and how the information that we did can also benefit them to continue to do these things.
Thank you. And before I read the question from the audience, Alexis, do you want to talk about what your hope is? How this work will be used?
So I hope that kind of going off of what Danielle said, that a lot of the stakeholders here today, and for those watching later on, because I know it's recorded, understand that their role is so intricate in order to improve the health of Delaware citizens. And the reason I say that is because a lot of the stakeholders hold prominent roles in leadership that really help to advocate for these issues or bring attention to these issues. And so when there's people like us who are trying to research, or individuals who are maybe higher up, they need to start from somewhere. And so once they are able to start that research, they're able to get insight from stakeholders who actually know and have individual connections with those that are impacted, or with those that could help to advance help the health of our communities. So I just feel as though that I really hope that stakeholders understand their importance and their prominence within these roles, and that they really do help to create a change.
Thank you, Alexis. And Connor, how about you? Your hope for our stakeholders, how they can utilize your work?
Well, both my colleagues already covered it so well, so I have a hard time surpassing either of them. But I'll say similar along the same lines that, I want stakeholders to know that their work's not going unheard. We're seeing the good that they're advocating for and pushing for socially, politically, economically, at all elements of society, and that these three public health issues that we presented today are something that we hope they will continue to focus on and address, because we students, we see the effort they're making, and we want, we want these changes as well. So, we applaud the work that they're doing. I mean, they're the real heroes down in the grass, grassroots, getting things done. So I just want them to know that they're not going unheard. We're seeing the efforts they're making for the betterment of Delaware and the entire country.
Thank you, Connor. I do want to pose the question that we got in the Q&A. Okay, so are there any additional areas you feel should be looked at that will uplift the COVID-related disparities? Any additional issues that you feel are important to bring forward to uplift the COVID health disparities? Anybody want to weigh in on that one?
The first thing that comes to my mind, I don't know if this is like even what they were thinking, but I was thinking like suicide rates and prevention, because I know, especially in the youth, that the rates have been increasing, and then lockdown, unfortunately, was affecting a lot of people's mental health. So I think research on that would be vital. And I think a lot of people are curious to see what the actual effects have been.
Excellent. Any other, Alexis?
I think adding on to that, I've been able, I have had the honor to be able to mentor through a program called Aspire High, which is located in New Jersey. And it's my chapter's philanthropy, so that's how I know within my sorority. But basically, I heard a lot of the individuals who work with these students have advocated for the fact that a lot of students have dropped out in high school. And so that is going to create so many issues down the road. And I think that looking at that now is so important, as I feel like a lot of students have, been very put under stressful situations, as we all have. And we don't understand maybe their roles in which their parents play, or the role, what roles they have to play within their household. So I think, further researching that or investigating that, and making sure that this is no longer going to be an issue, because students shouldn't be either forced to drop out of school in order to provide for their families. Whatever the case is, I feel like we need to research that and need to nip that problem now before further issues occur down the road.
I think you're absolutely right, Alexis, and not only the students that we lost because of dropping out, but also those who were attempting to learn remotely. Has that academic progress been delayed because of COVID, and how do we mitigate that in a way that is healthy, that doesn't stigmatize our student body or burn them out? How do we address that? So I think that's right. I also in the chat, I don't know, you all have reflected upon policy. Someone has asked, please state the bills that each one talked about. And Danielle, I think you had some specific bills you were tracking, correct?
Yeah, the main one I mentioned was House Bill 37, which is the Public Health Emergency Credit Bill.
Thank you. Any other one outside of that?
Not that I mentioned just now, I don't believe.
Okay, and Alexis, I think you brought up the family leave bill, and I know Senator sponsor, I don't have that number, but I know that's making its way through, and the minimum is as well. But any other local bills that anybody wants to bring up? So I might have more. Okay, so Noelle is offering, students mentioned some bills that have been passed, but focused on evidence for effective policies, more from a recommendation perspective rather than endorsing a specific bill. Thank you, Noel. And kind of a global, like the health and all policies and that as well. I am just checking our Q&A and also asking students, is there anything else that you would like to share with us based on the opportunity that you had? I know Hodge is gonna talk more. And again, Noel put in the chat that we wanna continue this level of student engagement and opening up this in the fall. Can you talk about the impact on you to be able to do this work and the value it brought to you as students through our fellowship program? Danielle.
Yeah, so this whole process has been very enlightening in many aspects, honestly. I think the main thing that really like struck me was most of the time when I'm doing like research is from a national perspective to see what's being done in America in general, but to get to like really go to these stakeholder meetings and see what's being done locally in areas that I grew up in, or just learning about Delaware's history and what's brought us to this point, especially with criminal justice reform, it was really like empowering and made me want to get more involved in our communities.
Thank you, Danielle. Alexa?
I definitely agree with Danielle. Having been raised within the state of Delaware for the majority of my life, I think being able to participate in such a program or such an experience overall has been, very rewarding. I feel like I've taken away a lot of things from this process overall. And I think it's made me want to be more engaged in understanding of what's going on within, the state of Delaware and what's going on within the communities, rather that be women or those who live in poverty or whatever the case is. I feel like this process has really allowed me to hone in on that and understand that, this is something that is important that goes on around me that maybe I'd never, noticed before, but it's definitely here. So I think it's kind of like shown that for me, and I appreciate that.
Thank you, Alexis. And Connor.
Biggest thing for me was certainly being able to contribute meaningful work. Obviously, depending, we're undergrads, we have different internships and whatnot. Obviously, some of them give you less important tasks than the other, but with the SHIP program, I felt like the work I was doing was actually being valued, that I was researching and I was ultimately producing the at a glance publication that was going to be posted on the website and an informative piece for lots of people to be able to see. And obviously I was able to present my findings here on the webinar today. So the biggest thing was I really just felt empowered in being able to, put together research findings that other people could appreciate and could be informative for people that want to learn more about a public health lens and the work that SHIP is trying to do to make a healthier, better Delaware of tomorrow.
Well, thank you, all three of you. It has been such an honor for me to be able to be the facilitator for this interactive discussion. What I always say, and I mean it, the future looks bright with the up and coming leadership that we have in the three of you, and really appreciate your level of engagement and really meaningful. I think, Connor, what I heard you say, to be able to do meaningful work that matters, and then to be able to share that with all of us, and honoring the stakeholders who are doing this on the groundwork and validating it for them as well. So we greatly appreciate the time that you have spent with us. Wonderful, not only the work that you did, but how you presented it and the passion that you bring. I can hear it in each of you. And again, the future looks bright. So thank you to the three of you. Haja, I'm going to turn it over to you. But before I want to pose the question for you as well, I'd love to hear your reflections on the work that you've been able to do with the SHIP, but in particular with the Student Fellowship Program. So take us away.
Thank you. First of all, I'd just like to say that I'm really, really proud of all the students. Like, their dedication to this work was really remarkable. And like the most rewarding thing for me was like working and like learning from them was really remarkable. And I got to see their passion for this work. And I know that wherever they go next, they would do great and wonderful work because they do have the passion for it and they're very smart and determined. So like that was really rewarding for me. I do hope to continue to like, inspire more student, like work with more student because it really is like important job and work. It really does like bring student input into these processes and kind of expose students to a lot of different processes so that they can develop the skill sets and knowledge needed to continue to like do this work we need to do in our communities and improving the health of all Delawarians. So it's like it was really important and inspiring, and I'm glad that I have been a part of this process. So moving forward, we do overall we hope and expect that. Hello, can you hear me? Hello.
We can hear you.
Yeah.
Okay. Overall, we hope and expect that the partner here today will look towards the State Health Improvement Plan and the other glances that will be published on the website as a resource to gain new competency and as a forum for diverse stakeholders to enter into conversation with one another. We do understand that everyone here today come from different background and expertise, but we all have the common goal of improving health for all Delawarians. Our students to approach this work from different level of expertise and background, but like this intensive experience, I hope has truly helped them like, you know, figure out what they want to do next. The student work is extremely hard on these other glances, so we would definitely appreciate everyone going on the website, downloading the other glances and reading them, and so that they can kind of make those connections that I'm sure the student will able to make in the other glance documents. There are definitely a lot of different connections to be made, and you definitely will find something to connect with and help improve the health of all Delawarians. Moving forward, I also like to remind everyone that we have the SHIP a stakeholder survey now available on the website. Please do take the survey and give your input. We really do appreciate your input, and it will definitely help inform the process of the Delaware State Health Improvement Plan so that everyone's voice and input is represented in the processes. We also like other glance document, like I said, it's on the website now. You can go directly from here, or later on you can just go on the website and it will pop up. Just like download it and read it. The student put a lot of work into it, and there's a lot of great information and insight in those documents. And also, like, please do join like the mailing list for the SHIP Partnership for Healthy Community, so that you can give us your input on like what you would like to see us do with the student, and also like just be a part of the process that we're trying to create here. We definitely want it to be a collective process where everyone input is important and matter. We definitely want your voices to come through the process. At this moment, we do have a poll that I would like to post to everyone to just get your input on certain stuff. The important question is, following this webinar, how likely are you to frame issues of criminal justice, housing, or the labor market as a matter of public health? To a great extent, somewhat, very little, not at all. 6 people have answered. We would love to have all of your input. Thank you so much for your feedback, and I would like to thank you so much for participating in our webinar today. Your input and your presence is really greatly appreciated. Thank you, and we hope to see you at other webinars that we will be hosting in the future.